How is genetic hearing loss inherited? Have you ever wondered how genetic hearing loss is passed down through families? Understanding this can help demystify the condition and provide insight into hearing health. Genetic hearing loss occurs due to changes, known as mutations, in specific genes that affect how our hearing system develops or functions. These mutations can be inherited in various ways, primarily through autosomal recessive, autosomal dominant, X-linked, or mitochondrial inheritance patterns. Let's start with autosomal recessive inheritance, which is the most common type, accounting for about 70 to 80% of non-syndromic genetic hearing loss cases. In this scenario, a child needs to inherit two copies of the mutated gene, one from each parent, to experience hearing loss. Interestingly, parents often carry one mutated gene each but do not show any symptoms themselves. This means that hearing loss can appear unexpectedly in a child, even when there is no prior family history. A notable gene involved in this pattern is the GJB2 gene, which encodes a protein called connexin 26. Other genes like GJB6 and SDRC also play a role in this type of inheritance. Next, we have autosomal dominant inheritance, which accounts for about 20% of cases. In this pattern, inheriting just one mutated gene from one parent is enough to cause hearing loss. This often leads to multiple family members being affected across generations. Examples of genes linked to this pattern include KCNQ4 and TECTA. Interestingly, some genes, such as GJB2 and GJB6, can cause hearing loss in both autosomal dominant and recessive forms, depending on the specific mutation involved. X-linked inheritance is a rarer form where the mutated gene is located on the X chromosome. Males are more likely to be affected if they inherit this mutated gene, while females may be carriers and experience milder symptoms or none at all. An example of a gene involved in X-linked hearing loss is PU3F4. In this case, affected fathers pass the mutated gene to all their daughters, who become carriers, but not to their sons. Lastly, there is mitochondrial inheritance, which is quite rare. This type involves mutations in mitochondrial DNA, which is passed exclusively from mother to all her children. Genetic hearing loss can be present at birth, known as congenital hearing loss, or it may develop later in life, depending on the specific gene involved. It can also occur as part of a syndrome that affects other body systems or as isolated hearing loss. Understanding these inheritance patterns is crucial for genetic counseling and assessing risks for future children. If hearing loss runs in your family, genetic testing can be a valuable tool. It helps identify specific gene mutations and clarifies the inheritance pattern. This information can empower families to understand the risks for future children and guide healthcare providers in managing hearing health effectively. Always remember, if you have concerns about hearing loss, consulting with a healthcare professional is essential for personalized advice and support.